Hello, everyone. Welcome to today's webinar. This is going to be a special presentation. This is a little bit different than what we normally do. This is a virtual demonstration of the Student Health Insurance Plan, also known as SHIP. We are going to walk you through the steps to get into the system and make your choices for student health insurance. My name is Mikkel St. Germain. I am the Director of Parent and Family Engagement at Brown University. And my guest today is Erica Larange, who is our insurance guru. Erica is the Assistant Director of Student Health Insurance Operations. And if you joined us for the Forms to Finances webinar, you've already heard some of what Erica has to provide in terms of insurance information. But I think she'll also give you some information about how to reach her directly if you have additional questions specifically after this webinar. This is going to be a working webinar. Feel free to send us questions as we go along. We highly suggest that if you have a computer nearby that you follow us as we do this process. But let's get started because I'm sure we'll have a lot of questions and steps to go through, hopefully not too many steps. But I want to give us plenty of time. So Erica, do you want to get us started?
Okay, so as Mikkel said, I am Erica Larange, Assistant Director of the Student Health Insurance Plan. So what we're going to go through today is what action you would need to take. All of your students started receiving this email last Monday, and it says, take action. Insurance portal is open. And the body of the email looks like this. It has all of the links in order for either action that you want to take. So I'm going to focus on enrolling into the medical plan first. Then I'll move to waiving the health plan. And then if we have time, we can go over enrolling into the voluntary plans, which are the dental and vision. But the process is the same for the dental and vision as it is for the medical. But if we have time and we're through all the questions, then by all means, I have no problem going through that. So anyone you would want to enroll if one, you just know that you want to enroll, you want the student plan, and you know that definitely for sure. So then you're going to select enroll. You would also want to enroll if you know that your insurance plan does not work outside of your area. So those are the two main reasons why you would enroll. If you're not sure if your insurance plan works in your area or if it meets all of our criteria, then I will encourage you to wait and then we'll go through the waive process. So we have a hard validation waiver process, which means anybody that waives, they upload their insurance information, and our insurance broker, Haler, Fryer and Kuhn, they look at each policy to make sure that it meets all of our criteria and that the plan is active. So with that being said, if anybody has any questions on whether they should enroll or waive, I'm not sure if you want me to handle those questions right now, Mikhail, before I move on to the enroll process, or what would you like me to do?
Well, it looks like we've already gotten a question that's come in about so if somebody's already submitted a waiver,
Okay.
about how long does it take to get a response?
Okay, so the waiver decision process is 5 to 7 business days. And then once you get your decision, if it's an approved waiver, then it takes an additional 5 business days to see it on your student's account.
Okay. I think maybe if we just briefly touch on the waiver, so that way if folks, if this webinar is not going to apply to them, they can,
Oh,
they
okay.
can make that
Right.
decision.
Okay, so you would want to waive if you're a student that's receiving financial aid, or if you're not sure if your insurance plan meets the criteria. If you're definitely sure it meets the criteria, you will also want to waive. Every student has to take action. So if you don't enroll or waive, then the student is automatically enrolled on August 29th, as the email says.
And we have a question about the response on the waiver, is that an email that's sent to students? How do people find out the
Correct.
decision on the waiver?
Yeah, so this email is only sent to the students. It's sent weekly at every Monday at 9 a.m. until the student takes action. And the frequency increases as the summer goes on. And then it's daily, like the last week of August, that they receive the email until they take action.
Okay, thank you. We had somebody ask specifically about Kaiser Permanente, if they have that as an insurance. Should they enroll or should they waive? Is that something you
They
would
should
know?
waive.
Okay.
There are different Kaiser Permanente plans, but seems like there's only one that meets the criteria, but many of them do not meet the criteria. They don't have non-emergency benefits while the student is in the state of Rhode Island. And I know that you have emergency benefits nationwide, but the plan has to provide non-emergency benefits without a referral or an authorization.
Okay, thank you. We did have a question about a specific letter a student received. I think, correct me if I'm wrong, Erica, but I feel like in a case where it's something very specific to a student, the parents and families should reach out to you directly. Do you want to just touch on how they contact you?
Sure, they can reach me at studenthealthinsuranceplan@brown.edu. If you have a very specific question, yes, by all means, email me and I can address your concern there.
Okay. Anything else we should know about waivers before we look at the portal?
Well, you will need a copy of your insurance card. So it would be, if you're going to walk through this process with us, then you'll want your insurance card. And I think that's about it. You will want to know your student's banner ID as well. So you can see it does give some information about financial aid. So you'll put the last name and enter the banner ID. We'll give everybody a minute or two to get that information in case they didn't have their banner ID in front of them.
Somebody had a question about, let's see, Aetna Insurance and then Anthem Blue Cross.
Okay, what are their questions?
Or
Do you want
should
me
they
to look in
waive?
the question
Should
thing?
they waive? Or does it
If you're
meet the
not-
requirement?
Yes, you should waive if you absolutely know that you do not want the student plan, or you absolutely know that, yeah, if you do not want the student plan, then you should waive. No matter what kind of insurance you have.
If you can tell me that email address again, that they can reach you out, can you give that to me again? Somebody's
Sure,
asking.
student health insurance plan@brown.edu.
And I'm chatting that out to everybody. So you have that as well. Yeah, let's get started. We've got a couple more questions. We can go through them as we go along.
All right, so this is your standard release form. If you hit I do not agree, then the process ends. So we're going to hit agree. And then it's next. So like I said, we're going to hit enroll because that's the process we're going to go through first. And then we'll just fill in all of the demographics.
And am I using my own name?
No,
here?
you just use something fictitious.
Okay. Well,
Use first 11119 or whatever you want. Just you have to you can't be older than like 50.
oh, okay.
So use a date of birth.
And what about international folks?
Yeah, they would put their country in international, domestic. Y'all go through the same process. For enrolling, if it's not accepting an international address, then you can always use 69 Brown Street, Providence, Rhode Island, 0209. You want me to put that in the chat?
Yeah, that would be great.
Okay.
So if their address is not being, if the system's not cooperating with that, there's another address they can put in, right? And that's the
Right.
health services. All right, I've gone through that, Erica, and now it's asking me if I have any dependents to enroll.
Yeah, and you're gonna say no. If you do have dependents, you would say yes, and this is where you would put their information in. So
Okay,
that part just says the effective date, the plan will begin on August 15th, 2025, and then the last day will be August 14th, 2026. I cannot unenroll a student after August 29th unless they leave the school before October 15th or they join the military. So once you enroll in this annual plan, you're enrolled in the plan. So I just want everybody to keep that in mind. So, I mean, we have a lot of time, and we have till August 29th. So if you're not sure if you want to enroll or if you should enroll, then I encourage you to email me, and then I can advise you on what action to take.
okay. Before we move on, we had a number of questions about, and we covered this in the other webinar, and the recording is available, but we can talk about it a little bit here, of financial aid students and submitting a waiver. And, you know, they're asking, do they take action and opt to waive now if they're on financial aid?
Yes, so if they're on financial aid, then they will want to waive.
Okay, thank you. All right,
Even
so
if they're enrolled in the student plan, so if they're second year, third year, fourth year, and they're on financial aid, they have to waive every year,
and this is regardless of their plan, correct?
regardless.
Okay. Um, and can we post the link that the folks should be using to do what I'm doing right here to,
Sure, I'll get it on a thing, a different one, yeah.
and it's on the health and wellness page, or if you just go to the brown.edu website and you type in student health insurance plan, or
It's not,
Haylor, it should come up.
yeah, it doesn't, it comes up, but it looks completely different.
Okay, so
This,
you,
the link that the student gets, that goes directly to the portal that they should be in.
okay,
So this is for the annual portal, because we have students that arrive early. We have PhD students, we have master's students, so they all have a different portal. So this one is for annual. So that will take you exactly to the place we are now. So
okay.
the email your student gets is catered towards the portal. So you're not going to a page and looking at our 8 different portals and wondering which one you have to go into.
This
That
is the one.
email directs you to the portal that you should be at.
All right, so everybody follow the link that Erica just chatted out. And that should get you where you need to go.
Okay.
All right, so we're here. We've got the effective start date and end date. Those are already pre-populated for us.
Yep.
And then we can hit the next button.
Okay, so this just states the amount of the premium and that it's going to be charged to the Bursar, that it's already charged to the Bursar account. It's confirmed that it's 4,944. And then it says, by this form, I'm consenting to enroll in the Brown University Student Health Plan. I understand that the premium charge for coverage will be on my Bursar bill. Then you just sign with your finger
Oh, okay.
or with the however type of screen you have. You can do it with your mouse, or it
Oh,
doesn't
that's
have to be
my
perfect.
really wonderful signature here.
Yeah. Then you'll scroll down
Okay.
and you'll type your name in. And then you'll hit submit. And it populates the name. So I'm gonna wait right here just for a minute so that everybody can see that they
Okay.
have to submit and that everybody can see their name. Because
Okay.
that's not
While
the
we're
end of.
waiting,
Oh, go ahead. Yeah.
we had some folks who just said, so what happens when financial aid students put in the waiver? Then what's the next step?
So if they receive an approved waiver, then the waiver is applied. So it offsets the charge. So the waiver
Oh,
offsets the charge.
and then they're enrolled in the Brown University insurance.
No, they remain on their own insurance. It means
Oh,
their
I see.
insurance meets our criteria. So you can kind of think of it this way, that the financial aid, the health insurance scholarship is a contingent scholarship. It's not a guaranteed one, so it's contingent on whether you have comparable insurance or not. So if you don't have comparable or have no insurance, you're eligible for the scholarship, just you have to have a denied waiver.
Got it. Okay.
Yeah.
Um, and we just saw that the bursar bill here is 4,944. That is separate from the health services fee, correct?
Correct. The health services fee you'll see each semester, and that's $618.
Okay, so yeah, so if you're seeing a bill and you see that amount, that is a completely separate fee from what the insurance is.
Right, and the insurance only gets billed in the fall, whereas the health services fee, you'll see it on the fall and the spring bill.
Okay. All right.
You'll see this screen, but then also in a few seconds, if you did the process correctly, you will get a confirmation email. And I know I was answering questions or typing, but where it says personal email, you can put yours, the parent's email. And then in the Brown email, you can put the student's email. This way you'll be notified of the waiver decision process or enrollment confirmation as well.
We've gone through the process of electing health insurance.
Right, so now you are enrolled into the student plan, so it's June 24th. So the student should receive an email about a week or so prior, like the first couple of weeks of August, and it will come from the insurance carrier, United Healthcare Student Resources. And it will say ID access and privacy policy. And in that email, there'll be instructions and a link on how they can get access to their ID card.
Okay. And say I just went through this process
Mhm.
and I submitted this, and then afterward I changed my mind or I learned some new information and I decided that no, I want to do the waiver. Do I have that option?
Yes, you have every option available, a plethora of options until August 29th.
Okay.
After that, it's by case by case situation. So you still have options after August 29th. Just you have to reach out to me directly. And then, we review each case and see, what's going on and make a decision on, so.
Okay. And if say a family's there's a job change or there's an insurance change throughout the year, is that still the case if they reach out to you? It's a case by case basis?
Right, so if there is any type of loss of coverage, or if your undergraduate age is off of the parent's policy, they can always enroll into the student plan. And if the student plan is, not affordable, then I can always help them to get a marketplace plan. Which I should also mention, you do have the option, if you didn't want the student plan, you could explore the marketplace and purchase a plan directly. And if you're interested in that, you can reach out to me at that email at studenthealthinsuranceplan@brown.edu.
Right. And Erica, can you explain the difference between the health service fee and the and insurance, what the fee covers as opposed to what insurance covers?
Sure, so the health services fee pertains to our Student Health and Wellness Center. So that allows your student to be seen here at the Health and Wellness Center and also by our counseling and psychological services at no charge. So they could come here, not that we want them to, but they could come see a provider every day and they would not receive a charge. So the health services fee covers that. Insurance comes into play if they receive an x-ray on site, or if they go to the lab downstairs or to the pharmacy. That's when insurance gets involved. So the health services fee is not an insurance, it's just a fee for a service that's offered to your student. here on campus.
Okay, and when they're not on campus, if they get the Brown University insurance, are they able to have coverage when they go home for breaks?
Yes, it is, the plan works nationwide and it does have out-of-country benefits.
Right. Okay. So should we do the waiver process?
I'm comfortable if if you feel like any more questions on enrollment or,
We have we've got some questions we can hit at the end of the session, but right now I don't think we have any on the enrollment process.
okay. All right, then I'm comfortable with going on to the waiver process.
Okay, so we're back at that main screen.
Is there any question on waivers while we're waiting for everyone to get to this part?
Let's see. Can we opt out of the health services fee?
No, it's a mandatory fee, non-waivable.
And what about allergy shots? Do you know if that's covered by the fee or by insurance?
The allergy shots, that would go through the insurance would be charged through the pharmacy, but they can administer the shots here.
I see.
But
Okay.
they're not covered by the health services fee. Insurance still would be charged.
Okay. And here's a good question. How does dental coverage work?
For the student plan, any student under the age of 19 until the last day of the month they turn 19, they have full dental and vision benefits. So they don't need to enroll in the voluntary dental and vision. So the dental has a $500 deductible, and it has all your preventive, the 3 routine visits, x-rays, and then it has a 50% co-insurance.
Okay. All right. So should we go ahead and show people the waiver process?
Yep, so in case some people just joined in the waiver process, so you'll want to hit agree, otherwise the process just ends. And then we're going to select waive. So you're going to select waive if you're a financial aid student. If you don't know if your plan meets all the criteria and you know that you do not want the student plan.
Just like we said before, if they waive it and then they decide they want it, they can do
Right.
that as long as it's before August 29th.
Exactly.
Okay.
So you'll fill all that in. And then I know I just said it a few minutes ago, but when it comes to the email part, on the personal email, you can put your parent email. The personal email can be the parents. And then the student email has to be the Brown one, but this way you'll be notified of the waiver decision as well. So you won't have to rely on your student telling you. Although we know all of your students are fabulous and they'll notify you of everything right away. So I'm sure that's not a concern for any of you, but in case it is concern for any of you, then you can put your personal email there.
Okay, so I've gotten all the way down to the birth date.
Right. Okay.
And now we've got a question about, I currently have active health insurance that is not the university student health insurance program.
Correct. So if you're an incoming freshman, then this answer is yes, you have another insurance, or no, you don't. Like no can be that you do not have any insurance. So then you would select no. But in majority of the cases, the student does have another insurance. So even if it's a Medicaid product that you know only works in your state, then say, yes, I do have other insurance. If some of you in this webinar happen to be rising sophomores or juniors or seniors, then you're on the student plan, you'll want to say, no, I do not have any other insurance other than the student health insurance plan.
Somebody was asking, you mentioned with the dental and vision, something under 19. What's the plan for folks over 19?
There is no benefits on the medical plan for students that are over the age of 19.
Okay, so what do most students do when they're over 19 and they need dental and vision coverage.
Then they normally do enroll into the voluntary dental and vision if they're not already on their parents' dental and vision.
I know it's a really confusing process for the waiver process and students on financial aid. I know we spent a lot of time trying to make this really clear, but it is a confusing process.
It is.
So can you explain again why people who are on financial aid have to fill out the waiver and then what happens once they do? Let's just assume they're approved. Like a financial aid student fills out the waiver for insurance and is approved. What happens next?
So then you'll see a line item on their account where it will say health insurance waiver, and it'll say minus 4944. So
Okay.
if you look on their bill right now, it says health insurance fee, 4,944. So that charge will stay there unless you waive it or you get a rejected waiver.
Okay. So no matter what, that amount, unless you are using a different type of insurance, is going to hit your your bill, but then the
Everybody is
waiver takes
charged
it
that
off.
4,000, yeah.
Okay.
Everybody is charged the $4,944.
And then
So
if
if
you're
you're on financial aid, the way you want to think about it is it's contingent. So it's not just a given that everybody gets the scholarship if you're on financial aid. You have to not document, what is that? What's that word? Not document. You have to show us that you don't have comparable insurance or that you don't have any insurance.
I think I can answer this from while you're typing. Somebody was wondering about uploading health information to the health system, and everybody here should know that we are onboarding a new system for documents. So students will get an email when it's ready for you to upload your documents. And the folks at Health and Wellness understand that this does cause a lot of delays for folks. So they're going to be really mindful of any sort of deadlines and adjust them accordingly based on when they get that system up and running. So right now, there's nothing that you can upload, but once your student gets an email, then they can begin uploading that information about vaccines and various things.
Yes, that's correct. Okay, so we can move on to the next question. Does your plan cover inpatient and outpatient medical care and mental health care within 50 miles of the college? And so you'll want to say yes. If you don't know, you can say no, because like I said, it is a hard validation process. And Haler, Fryer, and Kuhn will check to see if your plan does provide non-urgent care within the 50 miles. So then is the plan provided by an insurance company based in the United States? So that's not the same as that your plan operates in the United States. So the plan has to be domiciled and administered in the United States. So can you answer that question? Is the plan compliant with the Affordable Care Act? About 99% of plans are, unless you're using like a concierge service or something like that. So that's most likely a yes. So Medicaid program, that's either a yes or a no. So can say no to that one.
Does it matter?
Like I said, it's going to be reviewed. So if you make a mistake there, it doesn't really matter.
And this, so it's asking now for a state. Is this
Right,
the
so like
state?
Medicaid, so like if you're on, say, Texas Medicaid, then you're gonna get a rejected waiver. But if you're on Connecticut or Massachusetts or Rhode Island Medicaid, you're gonna get an approved waiver.
And why is that?
Because they still have, because Rhode Island is small and it's still within 50 miles to get to non-emergency care.
Okay, so it's about location.
Right, so they still have access to non-emergency care. Because Connecticut's 40 minutes and Massachusetts is even less.
Okay.
Okay, so that's a yes or a no, undergrad. And it doesn't matter the amount of financial aid, even if it's $10 or it's a full ride. You'll want, if you're receiving any kind of financial aid, then you'll want to say yes. And then this one, will your insurance plan be in effect for the entire academic year? So if you know that you're going to, say, change a job or something like in September or October and you're not sure, then you can still say yes on this. And if you lose coverage or you change your coverage after August 29th, then you can always reach out to me and we can take care of it then.
Okay. A couple questions that have come in. If my child is on financial aid, do we click no for the question was asked if they have active health insurance?
Well, do they have health insurance? If they have health insurance, say yes. If they do not have health insurance, say no.
It doesn't, right, it doesn't matter. The waiver the waiver is not contingent on whether they do or don't have health insurance, correct?
The waiver is not contingent on it. The scholarship is contingent on it.
Okay.
Because if
So,
they don't have insurance, then they're automatically going to get a denied waiver, meaning they'll get the scholarship. If they have insurance, but it's not comparable, means it doesn't meet all our criteria, they'll get a denied waiver, they'll get the scholarship. If they have insurance and it meets all of our criteria, they're going to get an approved waiver.
got it.
So in that question, just think of it this way. If you absolutely do not have any health insurance, that would be the only reason why you would be answering no.
Okay. So just answer what your situation is.
Right.
Okay. This one's a little bit off topic, but probably of interest to a few people. So say a student decides to study abroad 1 year. What happens with insurance? Does this insurance still apply?
Well, if they have their own insurance and it's a PPO, then it covers them when they're out of the country. And this plan covers them when they're out of the country as well. But each year, even if they're going abroad for the full year, they still have to take this action every year.
Okay. So they're going to be doing this process for 4 years at least.
Mhm.
Okay. And a question about, we talked about Massachusetts, Rhode Island, Connecticut, all these nearby states would be approved. What about New York?
No.
Okay. It's just a little bit too far.
Yeah.
Okay. All right. Should we keep going?
Sure. So we're on, so then you'll select your insurance carrier.
All right. You want to give me one to put in there?
Yeah, you can, if you start typing like blue.
Oh, it just comes right up.
Yeah, so.
Okay, we'll just say we're in Michigan.
Yeah. So then then you put the ID in. So now this one is policyholder. This is not normally the student. This is you.
Okay.
You might want to put like Mom Bruno or something. And then it's the policyholder's date of birth, not the student's.
Okay. Oh, it wouldn't be 20. That's the future. Okay.
Okay, so then you're just going to confirm the date of birth. The group number is not asterisk, so don't worry about it. So this insurance company address, this is normally on the back side of your insurance company. I mean, on your insurance card, and it's the claims address that they're looking for. So if on the back of your card, you don't see an address, what you can do is you can just Google, say, Aetna claims address.
Okay.
So you can just Google it, and then normally 99% of the time it's a PO box number. So then that's the information that you want to put in. It's not like the insurance headquarters. And if you have a picture of your dog or cat, Kale, you can upload a picture of your dog or cat. Or a blank piece of
Okay.
paper or something that doesn't matter.
Let's see.
Okay, are there any more questions about this page? Because there's a lot of questions on this page, so let me see. I'll look at the questions. We'll give people a few minutes. Let's see, 12.
This person wanted clarification that New York is too far for a waiver.
Well, if it's the Medicaid, if they have like the New York Blue Cross Blue Shield Empire, that's a PPO, then that would be an approved waiver.
Okay. So a lot of this information is really specific to your personal situation.
Exactly.
So it's, if there are questions, I would encourage folks to reach out to Erica. She's very accessible and really, really knowledgeable.
Yeah. So I don't know. So this one says, how do we submit our insurance info if we waive ship and we go to the lab or the pharmacy? Same thing is, if they get an x-ray, the student will either pay for it at the time of service if they don't have the student plan, or it'll be charged to their Bursar account. The lab and the pharmacy, they'll present their insurance ID card just like they do whenever they go to any other doctors. So at what point does the waiver come off? It's about 5 to 7 business days after you get your waiver decision. Okay, so. Okay, so this one about that I was filling out the waiver, it stated I was responsible for all financial responsibilities. So what that disclaimer is referring to is the out-of-pocket cost. So the scholarship covers the premium, which is the $4,944. The insurance plan, the student plan, still has a $300 deductible for some services and a $15 copay. So that disclaimer is stating that you're responsible for any deductible charges that you incur or any $15 copays. That's what that disclaimer is referring to. It's not referring to the premium. Okay. Please run through the steps to complete this if the student is from India. The steps are all of the same. Just if it's not accepting your international address, then you can use that Providence address and that telephone number I put in the chat. Not applicable. Yeah, if you selected the Medicaid not applicable, that will be a problem. No, that's not a problem. The insurance, if the current insurance doesn't cover drugs, it's probably not Affordable Care Act. Or if you mean like you have CVS that covers your pharmacy, then that's fine because it's when they look up your insurance, it's going to see that you have a pharmacy carve out, they call it. So that's not a problem. Travel insurance is not accepted. It has to be a comprehensive plan. So it is while in the US during July. I guess you would still select no. Do you have, yes, you would still select no, the one for the travel insurance. That's correct. You'd select no. Upload image of my parents' card on my student's card. You would upload a picture of the insurance card or the student's, it doesn't matter, just a copy of the insurance card once you're talking about the Brown ID. Complete the form. Could you please clarify the process going forward? So for students on financial aid, select waive and complete the form. Could you please clarify the process going forward? So if they're on financial aid and they waived, then there's no further action to be taken. If they get an approved waiver, the waiver will be applied. If they get a denied waiver, then the scholarship will automatically be applied and they'll automatically be enrolled in the plan as well. Do you think you want to hit submit and then?
Yeah, let's do it.
Okay. So now it comes down, there's that disclaimer, like I said, that refers to the out-of-pocket cost with any insurance plan. It doesn't refer to the premium, so then once again, Mikhail, you'll sign. And then hit submit.
I think I put junior on this one.
And then you'll see the confirmation here, and you should get the confirmation email within a few seconds. If you don't get the confirmation email, something went wrong.
And somebody was asking, what if they fill this out, but they accidentally put their student's personal email instead of their Brown email? Is that going to be a problem?
It's not a big deal. It'll just, it may be difficult for the student when they go to register for their United Healthcare account. If they get a denied waiver and they get enrolled into the plan. But if they have their own insurance, it's not going to be a problem.
Okay. And so we had another question. If you're on financial aid, but your current coverage is sufficient, can you still choose the University Healthcare plan after you do the waiver?
You can, but if you have insurance that meets the criteria, you get an approved waiver, then you're not eligible for the scholarship anymore.
Okay.
So the scholarship is for students that don't have comparable insurance and have no insurance.
Okay.
So I guess you could rephrase it for insurance that doesn't work while they're in Rhode Island or no insurance. The scholarship is not meant for to replace a high deductible plan. So that, because the student plan is better than your plan, the scholarship is not meant for that.
Okay. And we said before, it takes about 5 days for
5
the
business
decision
days.
and then another 5 days for it to hit the account.
Yeah, business days, business
Okay.
days, yeah.
And if somebody's plan ends on December 30th, say it ends at the end of this year, and that's what they enter into the system, how does that affect the waiver process?
Then they will probably get a denied waiver.
Okay.
So another thing is if you get a denied waiver or an approved waiver and you feel the decision is wrong, then please reach out to me and I will review it further, because sometimes the picture of the ID uploaded and it didn't upload well. When you get the denial, it will tell you why you were denied. So if you disagree with the decision, then, please reach out to me. And in the flip, if you know you have Medicaid that doesn't work in Rhode Island and for some reason you get an approved waiver, that's another reason to reach out to me and we'll research the decision. And if it needs to be reversed, then we'll reverse it. But this is all best done before August 29th. That was not proper English, I guess, but.
And I think we know what you mean. Erica, can you talk a little bit more about how people get in touch with you directly?
Sure, you can email me at studenthealthinsuranceplan@brown.edu. And I'll put the link in for my appointment calendar, but my appointment calendar is also on the website if anybody ever wants to just make an appointment with me so that we can talk about something in further detail, or if you have questions.
I do want to make a plug for the webinar we did last week, and it's called From Forms to Finances. And there's a recording there. It also goes into detail about the waiver process. We have a colleague from the financial aid office on there who talks about a little bit more from the financial aid perspective. So that might be something you want to take a look at. We had a question, if I'm an international student and I'm already receiving the health insurance scholarship from Brown, do I still need to apply for a waiver even if I don't have any other international insurance that is covered in the US?
Yes, you do. So you're going to want to select waive, and because that question is, do you have any other insurance other than the student plan? And so you don't, so you'll say no. And then the application will end there and you'll sign. So you have to take that action every year, international or domestic.
And then if somebody waives the insurance,
Mhm.
they're using their own insurance, and they go use the Brown University campus lab or some other service that requires additional health insurance. How does the billing work? Do they bill them directly or do they bill insurance?
It works the same as when you go anywhere else, so they will bill the insurance. The lab downstairs doesn't collect any money, so it's not a pay at time of service. They'll bill the insurance and they'll send a bill. So if they go to the pharmacy, they'll pay their regular copay and the rest will be billed to insurance.
So if folks go to families.brown.edu and that will get them to the main parent and family website. And then if you go to the tab that says webinars, you will be able to see a drop down and you see the upcoming webinars and then you will see past webinars. If you click on this from forums to finance webinar, you are going to be directed to this video that has a lot of great information on insurance, on healthcare, on financial aid, and also on student financial services. So I recommend anybody who hasn't had a chance to watch that, go ahead and do that. And if you want to watch this session, you can do that as well. It takes us a couple days to get this edited. Our media services friends do that for us, and then we post it as soon as we can. So if you want to refer back to this, and you have more questions or you weren't able to follow along with us, then you can do that at that time.
All right, so there's a couple of questions. So I accidentally enrolled instead of waived. So Jen, just email me and I can have your portal reset so you can go back in there and take action again. That's not a problem. My child is turning 19 in December. Can they enroll after December? For dental and vision, we do have a open enrollment for the spring semester, but only for dental and vision. So they would be able to enroll then. Okay, let's see.
And then this was one about somebody turning 19 in December.
Yeah, just
And
address that one for the
oh,
dental.
okay, you got that one. And then we have one about medical forms not being able to upload yet. Uh, I would say there isn't a, so we had a question about medical forms and how do we know what exactly will be needed. And I would say if, as I mentioned before, the health and wellness folks are at work trying to get this up and running. It's a complicated system, but they are gonna have that for you any day now. And I will say that they're very understanding that this is going to require maybe a longer lead time for doctors and things like that. So I would just say hold on for a few days, but if you have specific questions or concerns, you can email me at family@brown.edu and I can get you to the right answer. All right, we are at 12:58. We had a request, another request for your email address.
Okay, I'll put it in there.
Erica, if you want to put that in. Again, the waiver, once you've entered that, it takes about 5 to 7 business days for you to get a response to whatever email address you listed in there. And then it takes about 5 to 7 days to hit the account. And there is Erica's email address.
I spelled it
Mine
wrong.
is family@brown.edu. And
Oh,
that's for anything, whether it's insurance or what other questions you have being a new family at Brown. I apologize for any questions we didn't get to, but I would say if there's something specific that you need, you still are unsure about, please contact Erica or myself. And if you have any questions about what email to send it to, uh, the the family email is really easy to remember. It's just
yeah, that's very easy. Yeah.
family@brown.edu. So remember that for the next 4 years, and we'll always get your response.
Not a lot of rooms to make mistakes. Like I misspelled my own email, so.
Yeah, I'm lucky. We got an easy one. All right, everyone, it's 1 o'clock. Thank you so much for joining us today. We look forward to seeing you at the next webinar, and we hope you have a great day wherever you are in the world. Take care.
Bye, everyone.